Ketamine, originally developed as an anesthetic, has gained attention in recent years for its potential in treating mental health conditions, particularly depression. Conversely, it also has become popular in the recreational drug scene for its dissociative and hallucinogenic effects. In this episode, we'll be following two distinct journeys, Emily's and Sam's. Emily's been struggling with treatment-resistant depression and has turned to ketamine therapy under medical supervision. On the other hand, Sam uses ketamine recreationally, often at parties and in club settings. Let's start with our therapeutic ketamine user, Emily. Her journey with this substance begins in a controlled medical setting under the care of a mental health professional. She's been battling treatment-resistant depression for years and has tried various treatments, including therapy and prescription antidepressants, with little success. Lately, she's been losing a lot of motivation and having trouble even getting out of bed. Her doctor suggests ketamine therapy, a new approach showing promise for cases like hers. At her first treatment session, Emily is both nervous and hopeful. She's aware of ketamine's reputation as a party drug, but also of its emerging role in mental health treatment. The initial dose is carefully calculated based on her weight and health history, following protocols from clinical studies. During the treatment, Emily rests in a comfortable chair in a quiet, calming room designed to provide a peaceful setting. This environment is critical, as research notes the setting can influence a patient's experience during ketamine therapy. Soft lighting, gentle music, and the presence of a medical professional help create a sense of safety and relaxation, allowing Emily to focus on her inner experience. As the ketamine begins to take effect, Emily feels a wave of relaxation. She notices a shift in her perception of time and space. Despite the changes, she remains conscious and able to communicate with her doctor. This conscious but altered state is a unique aspect of ketamine therapy, allowing patients to explore thoughts and emotions from a different perspective. Post-treatment, Emily reflects on her experience. She feels a sense of detachment from her depressive thoughts. This detachment can provide patients with a new perspective on their mental health challenges, offering a mental reset that can be therapeutic. Emily's doctor explains that this effect is part of ketamine's unique action on the brain, which can disrupt harmful patterns of thought. Encouraged by this initial success, Emily continues her ketamine therapy, scheduled over several weeks. Each session builds on the last, and her doctor closely monitors her response to the treatment. This careful, methodical approach to ketamine therapy is crucial, ensuring that patients like Emily receive the full therapeutic benefits while minimizing potential risks. As Emily continues her ketamine therapy, one of the most noticeable changes is a significant improvement in her mood. After just a couple of sessions, she begins to experience a sense of well-being that she hasn't felt in years. The swift change in mood is attributed to ketamine's unique mechanism of action in the brain. Unlike most traditional antidepressants that target the serotonin system, ketamine acts on the NMDA receptors, which are part of the glutamate pathway, the brain's primary excitatory neurotransmitter system. This action results in a rapid increase in glutamatergic activity, leading to mood elevation. For Emily, the improvement in mood brings a renewed sense of hope and motivation. Activities that once felt overwhelming or unenjoyable start to become more manageable and rewarding. Interestingly, Emily's experience also points to ketamine's potential in breaking the cycle of negative thought patterns commonly associated with depression. Some studies suggest that ketamine may disrupt harmful neural circuits involved in depression. For Emily, this means a noticeable reduction in rumination and negative thinking, allowing her to engage more positively with her surroundings and relationships. However, Emily is aware that these mood improvements may be temporary and that ongoing therapy sessions are essential to sustain the benefits. Her doctor explains that while the initial response to ketamine can be profound, maintaining its effects typically requires a series of treatments. Research underlines the importance of a continued treatment regimen to prolong ketamine's antidepressant effects. Despite the positive changes, Emily remains under close medical supervision. Her doctor monitors her for any potential side effects and adjusts her treatment plan as needed. This vigilant approach is crucial, as noted in clinical guidelines, to ensure the safe and effective use of ketamine in treating depression. At first, Emily is required to complete daily check-ins to report her moods and any side effects. Once she shows promise with ketamine treatment, these change to weekly check-ins with her doctor. Emily's journey in ketamine therapy brings her not just relief from her depressive symptoms, but also a deeper understanding of her mental health. Each session contributes to a gradual but significant shift in her overall well-being, illustrating the potential of ketamine as a powerful tool in the treatment of depression. As we'll see throughout our episode today, her story is a testament to the evolving landscape of mental health treatment and the promise of new rapid-acting therapies like ketamine. Let's dive in a little deeper to what types of experiences Emily has during her ketamine therapy sessions. After the drug is administered, Emily experiences altered states of perception, a common and expected effect of treatment. These sensory changes range from a feeling of disconnection from her body to altered visual and auditory perceptions. Such effects are highlighted in research that notes that ketamine can induce a dissociative state, altering how patients perceive their environment and themselves. Emily describes these experiences as feeling both surreal and enlightening. She reports sensations of floating and a sense of detachment from her physical body. These sensations, while initially disconcerting, become a part of her therapeutic journey. Studies in multiple journals have observed that these dissociative experiences can contribute to the therapeutic effects of ketamine, offering patients a new perspective on their mental health challenges. During her sessions, Emily also experiences a heightened sense of clarity and introspection. She finds herself contemplating her life and mental health from a perspective that feels removed from the emotional pain of depression. This introspective state, as discussed in psychiatric studies, can provide valuable insights and is a key component of ketamine's therapeutic action. Interestingly, Emily notes that her perception of time seems altered during her treatment. Moments feel elongated and her sense of time passing becomes less linear. This altered perception of time is a recognized effect of ketamine. It allows patients like Emily to process thoughts and emotions without the usual constraints of time, often leading to deeper therapeutic insights. Emily's doctor explains that while these altered states of perception are common, they vary greatly between individuals. The experience is subjective and can be influenced by a range of factors, including dosage, individual physiology, and psychological state. To ensure her safety and comfort during these experiences, Emily's sessions are closely monitored by her healthcare provider. The controlled setting and the presence of a medical professional help Emily navigate these altered states without fear or anxiety. As Emily continues her ketamine therapy, she begins to notice improvements in her cognitive functions. Initially clouded by the fog of depression, her ability to think clearly, remember details, and concentrate on tasks gradually improves. During her therapy, Emily experiences moments of heightened clarity and creativity. She finds herself able to approach problems with a new perspective and engage in complex thinking that was previously overwhelming. This improvement is a critical aspect of her recovery, as cognitive impairment is often a debilitating component of major depression. Science suggests that ketamine's rapid antidepressant effect can also lead to quick cognitive improvements, which is a stark contrast to some traditional antidepressants that may initially exacerbate cognitive issues. However, Emily's doctor cautions that while ketamine can have immediate positive effects on cognition, the long-term impact on brain function is still a subject of ongoing research. An important aspect of Emily's cognitive improvement is her renewed ability to engage in psychotherapy effectively. With clearer thinking and improved concentration, she's able to participate more actively in her therapy sessions. This synergy between ketamine treatment and psychotherapy is crucial for holistic treatment of depression, as it allows patients to process and work through emotional challenges more effectively. Emily also finds that her improved cognitive function positively impacts her daily life. She's more organized, can manage her responsibilities more efficiently, and feels more mentally present in her interactions with others. It's worth noting that while Emily experiences cognitive benefits from ketamine therapy, responses can vary significantly between individuals. Research reports that factors like dosage, frequency of treatment, and individual brain chemistry can influence the extent of cognitive improvement observed in patients undergoing ketamine therapy. What other benefits is Emily seeing as she undergoes ketamine therapy? One of the most groundbreaking aspects of Emily's treatment is its impact on neuroplasticity, the brain's ability to reorganize and form new neural connections. Before starting ketamine treatment, Emily's depression had left her feeling mentally stagnant, as if her brain was stuck in a loop of negative thoughts and emotions. However, as her treatment progresses, she begins to experience a sense of mental flexibility and adaptability. Emily's doctor explains that depression often leads to a decrease in neuroplasticity, making it difficult for patients to break free from negative thought patterns. Ketamine, however, works differently from traditional antidepressants. Research indicates that ketamine rapidly activates synaptic plasticity by promoting the growth of new synapses and enhancing communication between neurons. This action potentially reverses the neural deficits caused by chronic stress and depression. As a result of this increased neuroplasticity, Emily finds herself more receptive to new ideas and ways of thinking. She's better able to learn from her therapy sessions and apply new coping strategies in her daily life. Her improved mental flexibility also helps her adapt to changes and challenges more effectively, a crucial aspect of recovery from depression. Emily also notices an improvement in her creative thinking. She finds herself more open to exploring different perspectives and engaging in creative activities, which she had previously lost interest in. Importantly, Emily's treatment includes strategies to sustain and build upon the neuroplastic changes initiated by ketamine. Her doctor emphasizes the importance of ongoing therapy, mental exercises, and lifestyle changes in maintaining and reinforcing these neural adaptations. However, Emily is aware that the long-term implications of ketamine on neuroplasticity are still being researched. While current evidence is promising, ongoing studies are necessary to fully understand how to optimize and maintain the neuroplastic changes induced by ketamine in the treatment of depression. As Emily continues with her ketamine therapy, she becomes more attuned to its various effects on her body. While the mental health benefits are significant, she also experiences some physical side effects, which are not uncommon with ketamine treatment. These include mild nausea, dizziness, and a sense of disorientation immediately following the therapy sessions. Emily's doctor reassures her that these side effects are usually short-lived and tend to diminish with subsequent treatments. He explains that ketamine can temporarily affect the vestibular system, responsible for balance, leading to sensations of dizziness and disorientation. To manage the nausea, Emily's advised to avoid eating heavy meals before her therapy sessions. Additionally, her doctor provides anti-nausea medication as a precautionary measure, ensuring her comfort during and after treatment. Another side effect Emily notices is an increase in her heart rate and blood pressure during the treatment. Her medical team closely monitors these vital signs, making sure nothing is out of the ordinary. These physiological changes are typically mild and resolve shortly after treatment. Emily also experiences a mild headache post-treatment on a few occasions. While not a universal side effect, headaches following ketamine infusion are mentioned in some studies. Her doctor suggests simple, over-the-counter pain relief, like ibuprofen, which effectively manages these headaches. Her journey with ketamine therapy is not a one-time treatment, but a continuous process that involves several sessions and careful monitoring. After experiencing initial improvements in her mood and cognitive functions, she understands the importance of maintaining a consistent treatment schedule. Throughout her treatment, Emily's progress is closely monitored by her healthcare team. This includes regular assessments of her mental health, tracking any changes in her symptoms, and adjusting the treatment plan as needed. This individualized approach is crucial to ensure the therapy is both effective and safe. Personalized treatment plans can significantly improve outcomes and are a hallmark of modern ketamine therapy protocols. In addition to her scheduled ketamine infusions and daily or weekly check-ins to self-report any side effects, Emily undergoes more in-depth psychological evaluations periodically. These sessions help assess the impact of the treatment on her overall mental health and quality of life. Monitoring also includes paying attention to any potential side effects or adverse reactions. While Emily experiences some mild side effects, as noted earlier, her doctor remains vigilant for any signs of a more serious complication. Emily also keeps a personal journal throughout her treatment, documenting her thoughts, feelings, and any changes she notices. This self-monitoring is a valuable tool as it helps her and her healthcare team understand her unique response to the treatment. As part of ongoing treatment, Emily is also educated about the importance of lifestyle factors in managing her depression. Her healthcare team advises her on eating healthy, regular exercise, and sleep hygiene, all of which can complement her ketamine therapy. As she progresses through her treatment, Emily notices a reduced reliance on her other antidepressant medications. Before starting ketamine, Emily was on a combination of traditional antidepressants, which had provided only partial relief. However, with the significant improvements in her mood and mental state post-ketamine, her doctor begins to cautiously taper down these medications. This reduction is done under strict medical supervision, as abrupt changes in psychiatric medications can lead to adverse effects. This gradual reduction in other medications is not only a positive sign of Emily's progress, but also helps in minimizing potential side effects associated with polypharmacy. Managing multiple medications can be challenging due to the risk of drug interactions and cumulative side effects. One scientific study discusses how simplifying medication regimens can improve overall treatment outcomes and patient quality of life, especially in the context of mental health. Emily's doctor explains that while ketamine has been effective in her case, the decision to reduce other medications is highly individualized. It depends on a variety of factors, including the patient's history, response to treatment, and overall health. As her reliance on traditional antidepressants decrease, Emily finds herself more alert and less burdened by the side effects like drowsiness and weight gain, which she had previously experienced. This improvement in her overall well-being is significant, as it enhances her ability to engage in daily activities and enjoy a better quality of life. However, Emily is also aware that this does not mean she can simply stop her other medications abruptly or without medical guidance. Her treatment journey is a delicate balance, and her healthcare team continuously assesses the need for each medication. Throughout the process, Emily keeps remaining in close contact with her healthcare provider. Those regular checkups and ongoing open communications help ensure that any changes in her medication regimen are safe and effective. Emily's journey with ketamine therapy is not just about the infusions themselves, but also about the integration of psychological support. Her healthcare providers emphasize that while ketamine can provide rapid relief from depressive symptoms, long-term recovery often requires a holistic approach. This includes ongoing psychotherapy, which plays a crucial role in addressing the underlying causes of her depression. During her psychotherapy sessions, Emily explores various aspects of her life that may contribute to her depressive state. With the cognitive clarity and emotional relief provided by ketamine, she finds it easier to engage in therapy, process her emotions, and explore coping strategies. The synergy between ketamine's effects and psychotherapy is crucial, as it allows Emily to work through her issues more effectively. Her therapist works with Emily to develop a personalized treatment plan that includes goals for her therapy, self-care routines, and strategies to handle potential stressors. This individualized approach is crucial, as it ensures that Emily's specific needs and circumstances are addressed, maximizing the effectiveness of her treatment. Part of Emily's therapy involves learning cognitive behavioral techniques, which help her identify and challenge negative thought patterns. With the improved neuroplasticity and cognitive function facilitated by ketamine, Emily finds these techniques more impactful. She begins to adopt a more positive and realistic mindset, a change that's often challenging for individuals with depression. The psychotherapeutic component of Emily's treatment also focuses on building resilience and developing healthier coping mechanisms. This is particularly important in ensuring that the gains made through ketamine therapy are sustained over time. One of the most notable changes for Emily is in her social interactions. Where she previously felt withdrawn and isolated, she now finds pleasure in socializing and connecting with others. This change is significant, as social isolation and withdrawal are common in depression. Emily also experiences improvement in her work life. She finds it easier to concentrate, stay more organized, and handle work stress more effectively. This increased productivity and reduced work-related stress contribute greatly to her overall sense of achievement and satisfaction, fueling her progress. How else is ketamine therapy benefiting Emily? Physical health improvements are another positive outcome. With her mood improving and energy levels increasing, she becomes more active and engages in regular exercise, which further enhances her mood and physical well-being. What about catching some Z's? Prior to starting ketamine treatment, Emily's sleep was pretty disruptive, frequently disturbed and unrefreshing, a common issue in depression. But with ketamine-assisted therapy, Emily's sleep quality improves significantly. As her treatment progresses, she begins to experience more restful nights. This improvement in sleep is not only contributing to her daily energy levels, but also her overall mental health. The therapy sessions help Emily develop new coping strategies for dealing with life's challenges. She learns mindfulness techniques and problem-solving skills, which equip her to handle stressful situations more effectively. This empowerment is crucial, as having effective coping mechanisms is associated with better long-term outcomes in depression treatment. As Emily approaches the latter stages of her ketamine therapy, ongoing monitoring becomes crucial to ensure her treatment remains effective and safe. One key aspect of her healthcare provider's focus is on the potential for developing tolerance to ketamine. Tolerance occurs when a patient's response to a drug diminishes over time, requiring higher doses to achieve the same effect. According to research, while ketamine has a lower risk of tolerance compared to other substances, it is still a possibility, especially with frequent use. Emily's medical team carefully monitors her response to the treatment adjusting dosages as needed to maintain effectiveness without escalating to higher levels unnecessarily. Another concern that Emily's doctor keeps in mind is the potential for psychological dependence on ketamine. While ketamine is not addictive in the traditional sense, like opioids or alcohol, some individuals may develop a psychological reliance on the drug, especially if they find its effects particularly beneficial. Emily herself is aware of these risks and remains in open communication with her healthcare providers about her experiences and feelings regarding the treatment. She understands the importance of using ketamine as part of a broader treatment strategy rather than a standalone solution. Regular assessments are conducted to evaluate her mental health status and responses to treatment. These assessments help in identifying any signs of tolerance or psychological dependence early on. Emily's treatment plan is continuously reviewed and adjusted based on her progress and any new challenges that arise. This individualized approach allows for a flexible and responsive treatment strategy, ensuring that Emily receives the most appropriate care at each stage of her therapy. In addition to monitoring for tolerance and dependence, Emily's healthcare team also focuses on maintaining her overall well-being and preventing relapse into depression. They work with her to develop a long-term maintenance plan, which may include periodic ketamine booster sessions, ongoing psychotherapy, and lifestyle modifications. Now, we've examined Emily's story of hope for treatment-resistant depression, but what about when ketamine is used in an entirely different context? Party culture. Let's take a look at our next character, Sam. Sam's journey with ketamine begins at a different crossroads than Emily's. As a college student frequently attending parties, he first encounters ketamine in a social setting. Unlike his counterpart, his initial experimentation is driven by curiosity and a bit of peer pressure. At his first encounter with ketamine, Sam is somewhat aware of its reputation as a club drug known for inducing a trance-like state and hallucinations. This knowledge is based on anecdotal accounts from peers, rather than from formal education or awareness about the drug's effects and risks, a dangerous way of exploring a new drug of any kind. During his initial experimentation, Sam consumes a small dose of ketamine, experiencing a sense of euphoria and disassociation from his surroundings. These effects are all characteristic of ketamine's impact on the brain, altering perception and mood. Sam's initial experience with ketamine is relatively mild, with no immediate adverse reactions. However, this initial foray into ketamine use sets the stage for further experimentation. Initial drug experiences can significantly influence an individual's attitude toward future use, often underestimating the risks involved. In the days following his first use of ketamine, Sam finds himself intrigued by the experience. He begins to research the drug online, but his findings are a mix of scientific facts and user experience reports from forums and social media. Despite the enjoyable experience, this research doesn't provide Sam with the right information, so he remains unaware of the potential long-term consequences of regular ketamine use. As Sam delves deeper into his recreational use of ketamine, he begins to experience the more profound effects the drug is known for. The initial euphoria he felt during his first use intensifies in subsequent sessions. He describes this feeling as a wave of happiness and a detachment from his usual worries and stressors. This euphoric effect is typical of ketamine's impact on the brain's neurotransmitter systems. Alongside euphoria, Sam starts to experience vivid hallucinations and altered sensory perceptions. These hallucinatory experiences range from mild distortions in visual and auditory perception to more intense dreamlike states. During one particular instance, Sam finds himself in a state commonly referred to in recreational circles as entering the K-hole. The K-hole is often a misunderstood phenomenon with ketamine users. This state is characterized by intense hallucinations and a feeling of complete detachment from reality. While some find this experience profound, for Sam it's disorienting and slightly unnerving. Despite the intensity of these experiences, Sam is drawn to the sense of escapism that ketamine provides. He feels a temporary relief from the pressures of college life and personal issues, which makes the drug increasingly appealing. However, Sam's frequent journeys into these altered states start to affect his perception of reality. Even when he's not under the influence of ketamine, he begins to experience mild dissociation during his daily routines, feeling detached and disconnected at times. Sam also finds that the more he uses ketamine, the more he chases the initial euphoric and hallucinatory experiences. This chasing of the first high is indicative of the developing tolerance. As tolerance builds, users often increase their dosage to recapture their initial effects, leading to a cycle of escalating use. The euphoria and hallucinations that Sam experiences with ketamine use represent a double-edged sword. While they offer temporary relief and enjoyment, especially at the parties Sam attends pretty regularly, they also pose risks to his mental health and perception of reality. As he continues to experiment with higher doses of ketamine, Sam increasingly encounters the K-hole, that profound state of disassociation and altered consciousness. This experience, often sought after by experienced ketamine users, involves a significant detachment from reality, where one feels completely separated from their body and their surroundings. The K-hole experience is unique to ketamine use due to its powerful dissociative properties, making it unlike the effects of most other recreational drugs. During one intense episode, Sam describes entering a K-hole as being catapulted into a different dimension. He feels as though he's floating in space, completely disconnected from his physical existence. Time and space become irrelevant concepts, and he experiences a mix of intense visual and auditory hallucinations. At times, this level of dissociation can be extremely disorienting and even frightening. There have been times when Sam couldn't stop screaming in a crowded club or sat in a corner crying at a party. In the K-hole, Sam finds himself confronting a range of emotions and thoughts, from euphoric insights to unsettling reflections. This introspective journey, while enlightening to some, is also laced with moments of anxiety and fear. Studies highlight how the K-hole experience can vary wildly among individuals. While some find it profoundly spiritual, others find it disturbing and disconcerting. But what's more, the after effects of such a profound dissociative experience are significant for Sam. He finds it challenging to reorient himself to the real world after coming out of the K-hole. Sometimes he has trouble focusing on his schoolwork for a few days. Despite the intensity of the K-hole experience, Sam is drawn back to it, seeking the profound dissociation and escape it provides. This repeated pursuit of the K-hole experience can be indicative of problematic drug use patterns, where the user prioritizes drug-induced states over everyday reality. Sam's friends start to notice changes in his behavior and express concern about his frequent ketamine use. They observe that he seems more withdrawn and less engaged in his usual activities, preferring to spend time chasing the next K-hole experience. This shift in behavior and priorities is a common sign of escalating drug use, where the drug experience starts to take precedence over other aspects of life. Sam's increasing fascination with the intense effects of the K-hole leads him to experiment with higher doses of ketamine. Unaware of the escalating risks this behavior entails, his pursuit of more profound experiences pushes the boundaries of safe use. During one particular instance, Sam consumes a significantly higher dose than his usual amount. Shortly afterward, he experiences symptoms that are far more intense and unsettling than anything he's ever encountered before. He feels an overwhelming sense of panic, his heart rate skyrockets, and he struggles to maintain a sense of connection to his surroundings. Following the episode, Sam suffers from intense confusion and a lingering disorientation that lasts for several hours. The experience leaves him feeling vulnerable and scared, a stark contrast to the escapism he usually seeks with ketamine. In the days following the high-dose experience, Sam notices a change in his overall mental state. He feels more anxious and has trouble concentrating, symptoms that persist longer than the immediate after effects of the drug. Sam's risky behavior also raises concerns about the potential for physical harm. High doses of ketamine can lead to respiratory problems and increased blood pressure, posing significant health risks, especially in unsupervised settings. Reflecting on his experience, Sam begins to recognize the serious risks associated with his ketamine use. He starts to question the wisdom of pursuing such intense experiences, realizing that the potential for harm far outweighs the temporary escape the drug provides. This self-awareness is crucial. This encounter with the risks of a high-dose ketamine use serves as a pivotal moment in his journey. He realizes that there is a very fine line between seeking recreational drug experiences and endangering one's health and well-being. As Sam's use of ketamine becomes more frequent and the doses he consumes increase, he starts to experience significant impairments in his motor functions. Following his high-dose experiences, Sam notices that his coordination and balance are adversely affected, a condition that persists for hours after the drug's effects have worn off. This impairment poses real dangers, particularly when it comes to activities like driving or operating machinery. One evening, after a ketamine session, Sam attempts to walk home, but finds himself struggling with basic motor skills. He stumbles several times and narrowly avoids a serious fall. This happens because ketamine can disrupt the normal functioning of the cerebellum, the brain region responsible for coordinating movement, leading to such impairments. Sam's friends who have been with him during some of these experiences express concern over his safety. They notice his unsteady gait and delayed reaction times, recognizing this as signs of impairment. The impaired motor function not only poses immediate physical risks to Sam, but also has broader implications for daily life. He finds it increasingly difficult to engage in activities that require coordination and precision, such as sports and certain hobbies. This decline in physical capability is a source of frustration for Sam, impacting his overall quality of life. Sadly, such disruptions in daily functioning are common among frequent recreational drug users. Sam's increasing awareness of these risks leads him to be more cautious following his ketamine use. He starts to plan ahead, ensuring he does not need to drive or engage in potentially hazardous activities after using the drug. This precaution, as advised in harm reduction guidelines, is crucial for minimizing the risk of accidents and injuries associated with impaired motor function. However, despite his precautions, the persistent effects on his motor skills begin to worry Sam. He starts researching the long-term effects of ketamine and realizes that chronic use can lead to more permanent neurological and physical damage. He finds articles discussing the potential long-term impact of ketamine on the brain and nervous system, reinforcing his concerns about the sustainability of ketamine use. What other side effects does Sam notice? As his recreational use of ketamine continues, he begins to notice changes in his cognitive abilities, particularly in the days following heavy use. He struggles with short-term memory lapses and finds it harder to concentrate on his college coursework. These cognitive impairments, while initially subtle, become more pronounced with repeated use. The memory issues Sam faces are particularly concerning during his studies. He finds himself having to read material multiple times to understand and retain the information, a task that was once much easier for him. In addition to memory problems, Sam also experiences a decrease in his attention span and an increase in distractibility. These changes are particularly evident in his inability to stay focused during lectures and while studying. These cognitive impairments begin to affect Sam's academic performance. He notices a drop in his grades and receives feedback from his professors about the apparent decline in his engagement and output. Concerned about these changes, Sam starts to limit his ketamine use, hoping his cognitive functions will return to normal. While he does notice some improvement, the recovery is slow. While the cognitive impairments caused by ketamine use are usually reversible, the recovery can vary based on the frequency and quantity of use, as well as individual differences. Sam also seeks advice from a counselor at his college, who suggests strategies to help him manage his cognitive symptoms. These include regular sleep patterns, a healthy diet, and brain-stimulating activities like puzzles and reading. Lifestyle changes can play a significant role in recovering from substance-induced cognitive impairments. While Emily was successful in undergoing ketamine therapy for depression, Sam is finding a different effect on his mental health. As his journey with recreational ketamine use continues, he starts to notice an impact on his mental health that extends beyond the immediate effects of the drug. Initially, ketamine provided an escape from stress and a sense of euphoria, but over time, Sam finds himself feeling increasingly anxious and experiencing mood swings. These shifts in his mental state become more noticeable, particularly in the days following ketamine use. Sam's growing anxiety manifests in various ways. He becomes more irritable, finds himself overacting to minor issues. His sleep patterns are disrupted, leading to fatigue and further exacerbating his stress. This cycle of anxiety and sleep disturbance is a common consequence of frequent ketamine use. Socially, Sam starts to withdraw from friends and activities he once enjoyed. He becomes more introspective, but in a ruminative and often negative way. This change in his social behavior and mood is a red flag. Alterations in social interactions and increased introspection can be indicative of underlying mental health issues exacerbated by drug use. Sam's academic performance also continues to suffer. The combination of cognitive impairments and increased anxiety makes it challenging for him to keep up with his studies. He starts missing deadlines and struggles to maintain his previous academic standards. It's true, mental health issues, particularly those influenced by substance use, can significantly impact a student's academic performance and overall college experience. Recognizing these troubling changes, Sam begins to question the role of ketamine in his life. He reflects on how his initial use of the drug for recreational purposes has evolved into a coping mechanism for underlying stress and anxiety. Individuals often use substances like ketamine to self-medicate for mental health issues, not realizing that this can worsen their overall mental health in the long term. Lured in by the party scene, Sam still decides to continue his frequent use of ketamine. Soon he starts experiencing an unexpected and concerning physical health issue, problems with his bladder. Initially, he notices an increased urgency and frequency in urination, which he initially dismissed as a minor annoyance. However, the problem gradually worsened, leading to discomfort and pain. Concerned, Sam consults with a healthcare professional who explains ketamine can be toxic to the bladder, causing inflammation and ulceration of the bladder lining. This toxicity is a well-documented side effect of long-term ketamine abuse. The doctor informs Sam that these symptoms are the result of his body reacting to the harmful effects of ketamine on his urinary tract. The impact on Sam's daily life becomes increasingly significant. He finds himself needing to use the restroom frequently, often with little warning, which disrupts his daily activities and affects his social life. In response to these symptoms, Sam is advised to significantly reduce or cease his ketamine use and is prescribed medication to help manage the inflammation and pain. Although he's getting really concerned, he continues to research and understand more about the potential long-term consequences of chronic ketamine use on physical health. But he doesn't fully stop his intake of the drug. He learns that prolonged exposure to ketamine can lead to permanent damage of the urinary tract and kidneys, highlighting the seriousness of his condition. The realization of the physical harm he's inflicting on himself is starting to serve as a wake-up call for Sam. As his use of ketamine becomes more frequent, he also starts to notice a significant change in how his body responds to the drug. Initially, small doses of ketamine were enough to induce the desired effects, but over time, these doses become less effective. He finds himself needing to consume larger amounts of ketamine to achieve the same level of dissociation and euphoria. This phenomenon is known as tolerance, a common issue with many psychoactive substances, including ketamine. The development of tolerance is a concerning sign for Sam, indicating that his body is becoming accustomed to the drug. This escalation can be dangerous, increasing the risk of both acute and long-term side effects. Medical professionals warn that higher doses of ketamine not only heighten the risk of immediate negative effects, such as severe dissociation and impaired motor function, but also increase the likelihood of long-term health issues. Sam's increasing dosage also starts to impact his daily life more significantly. He finds himself spending more time and money obtaining and using ketamine, which begins to strain his finances and affect his responsibilities. Even so, despite growing tolerance, Sam continues to use ketamine, driven by a desire to escape reality and the habit he's formed. This continued use, despite the clear signs of tolerance, is a red flag for potential substance use disorder. In fact, continued substance use in the face of tolerance is a key indicator of developing addiction. The psychological aspect of tolerance also becomes apparent to Sam. He finds that the psychological relief and escape that ketamine once provided are less pronounced, leading to a sense of frustration and dissatisfaction. One journal notes that tolerance can extend beyond the physical effects to the psychological benefits of drug use, leading users to chase an increasingly elusive high. Concerned about these developments, Sam starts seeking information and advice on managing tolerance. He learns that taking breaks from ketamine use, also known as drug holidays, can help reduce tolerance levels. However, he also understands that his strategy should be approached with caution and ideally under medical supervision to avoid withdrawal symptoms and other complications. In his academic life, the consequences of consuming the drug regularly become even more pronounced. He begins to struggle with keeping up with his coursework due to the cognitive impairments and memory issues resulting from ketamine use. He misses deadlines, his grades begin to slip, and he receives warnings from his professors about his declining performance. Sam also finds himself increasingly isolated. As he spends more time under the influence of ketamine, his ability to engage in meaningful conversations and relationships diminishes. He feels a growing sense of loneliness, yet finds it difficult to seek support or reconnect with his peers. The changes in Sam's behavior do not go unnoticed by his family. They express concern over his well-being during phone calls and visits, noticing that he seems different and less vibrant than before. Studies show that substance abuse can strain family relationships, causing concern, mistrust, and communication breakdowns. The social consequences of his ketamine use lead Sam to reflect on his choices. He starts to realize the impact of his drug use on his relationships and overall quality of life. This self-awareness is a crucial step in the battle against addiction. At the same time, Sam's academic struggles serve as another glaring wake-up call. He begins to recognize the potential long-term impact of his drug use on his future goals and aspirations. As Sam confronts the various impacts of his ketamine use, he reaches a critical point of self-realization. He acknowledges that what started as recreational use has spiraled into a pattern of behavior with serious negative consequences on his health, academics, and relationships. Prompted by his own concerns and the encouragement of his family and friends, Sam decides to seek professional help. He contacts a campus counselor and opens up about his struggles with ketamine. The counselor listens and provides a safe space for Sam to discuss his experiences without judgment. During one of these sessions with a school counselor, Sam learns about the psychological underpinnings of his drug use. He begins to understand the role of stress, anxiety, and escapism in his decision to use ketamine. This insight is a key step in addressing the root cause of his substance use. The counselor works with Sam to develop healthier coping mechanisms for dealing with life's challenges. Sam is also referred to a healthcare provider for a full medical evaluation, including assessing the impact of his ketamine use on his physical health. This comprehensive approach to treatment encompasses both mental and physical health. It ensures that all aspects of Sam's well-being are addressed. One significant aspect of Sam's recovery journey is rebuilding his relationships with friends and family. He starts to engage more with his social circles, explaining his situation and apologizing for his withdrawn behavior. Rebuilding these connections is therapeutic for Sam, as strong social support networks are critical in recovery from substance abuse. Academically, Sam works with his professors to develop a plan to catch up on missed work and improve his grades. He utilizes campus resources such as tutoring and academic advising to get back on track. Another of the key components of Sam's recovery plan is relapse prevention. He works with his counselor to identify triggers and high-risk situations that might lead to ketamine use and develop strategies to cope with them. These include engaging in alternative activities, seeking support from friends and family, and using stress reduction techniques. Effective relapse prevention strategies are crucial in maintaining long-term sobriety. Sam also makes significant lifestyle changes as part of his recovery. He starts exercising regularly, which not only improves his physical health, but also helps manage stress and improve his mood. He adopts a healthier diet and ensures he gets enough sleep. To rebuild his academic standing, Sam remains committed to his coursework and utilizes support services offered by his college. He finds that as he stays sober, his cognitive functions improve, making it easier for him to study and retain information. Social support also plays a crucial role in Sam's recovery. He spends more time with friends who support his sobriety and distances himself from situations where drug use is prevalent. Throughout his recovery, Sam remains in counseling, which provides him with continuous support and guidance. He finds that therapy helps him address underlying issues related to ketamine use, such as anxiety and stress management. So now that we've gone along for Emily and Sam's journeys with ketamine, perhaps you're wondering about trying the drug for yourself. If so, here are a few tips for using ketamine responsibly. To all the ketamine-curious viewers out there, we hope Emily and Sam's stories have been enlightening. Let us know your thoughts by dropping a comment. Then check out what happens to your body when you do cocaine, or watch this video instead.